Oral health is such an important part of general health, and it's often really overlooked by the medical industry. And here at the Oral Health Association of Australia, we're really focused on putting the mouth back in the body and discovering and working on how we can help improve people's general health and oral health.
We've got nearly 3,000 professionals who have now joined the organisation. We've still got lots of room for scope to improve that, and we're very hopeful that going forward and very soon will represent the overwhelming majority of oral health practitioners across the country.
My name's Cheryl Dey. I'm the President of the Oral Health Association of Australia. We're a new association just launched January 1, 2025, and we are here to represent oral health professionals, so that's dental hygienists, dental therapists and oral health therapists throughout Australia.
Hi, my name's Nathan Clarke. I'm the Chief Executive Officer of the newly formed Oral Health Association of Australia. We're here at our first official OHAA Congress, which is sitting on the beautiful Gold Coast, and we're here for 3 days. And the theme is Opening Horizons, which is about trying to expanding the horizons of the oral health practitioners network and scope and everything that comes with that. We've had a great couple of days so far. We've got over 500 people attending the 3 days here in the Gold Coast, and they've come from all across the country, which we're really thrilled about. We've got nearly 3,000 professionals who have now joined the organisation. We've still got lots of room for scope to improve that, and we're very hopeful that going forward and very soon will represent the overwhelming majority of oral health practitioners across the country.
So our Congress theme for this year is Opening Horizons across Australia. Educators, researchers, advocates, clinicians from all parts of oral health presenting to us here this weekend on a variety of topics. We're covering innovation, collaboration, clinical practice, research from every corner of oral health, really encompassing all areas of our oral health practice, from the hygiene to the therapy, education fields and new research that's being developed. Oral health providers are really part of the primary care medical team, and we're looking after patients from all ages of life, all walks of life across all areas of Australia. So to have a conference like this where we can all come together, we can learn from each other, we can learn from experts in our field and from newly developed research, it's really important to build those professional relationships and build on those friendships that are built over many years at congresses just like this, and to keep learning from each other, keep talking to each other so we can all work together to improve the oral health of our communities.
We've got nearly 50 exhibitors from the whole depth and breadth of the oral health sector across Australia. So it's been a really great experience for me to get to know these organisations and what they're expecting coming here. The conversations I've had with them, they've been thrilled with the variety and the number of people who are coming to the Congress. And from my perspective, they've been really thrilled that we are now a unified organisation and one voice for the oral health sector, which is, as you can imagine from their end, makes it much easier and simpler for them to communicate with one organisation. But they really see the value and the benefit of one unified voice for oral health in Australia.
Oral health is such an important part of general health, and it's often really overlooked by the medical industry. And here at the Oral Health Association of Australia, we're really focused on putting the mouth back in the body and discovering and working on how we can help improve people's general health and oral health, because it can have such an impact on their life. We really want to promote oral health professionals as an integral part of the primary care team and really help those at-risk communities, making sure that we are delivering services so that everybody has equitable access to oral health care and making our communities as healthy and happy as possible. I think one of the key messages that we want to put forward for our profession is collaboration. So we're all here together this weekend, which is amazing, and as oral health professionals we're all collaborating together, but we'd like to really put forward as the Oral Health Association collaborating with the wider community, with medical professionals, with allied health professionals, with primary care networks, to make sure that we are delivering those services that our communities really need, especially those at-risk communities.
And from a single entity point of view, the membership should be seeing much greater membership offerings, ability to network more, do more, see more. So we see that as a really great value add for members of the unified organisation.